Today I would like to talk about a study published at JASN in December issue. JASN stands for Journal of American Society of Nephrology. The reason I want to talk about this, we often get questions from our patients if there's any new medications coming to market to help treat chronic kidney disease or prevent loss of kidney function. Diabetic kidney disease is still the most common cause of end-stage renal disease in the world, and we often see mostly these cases in our clinics. So therefore, I would like to talk about a new experimental medication that's under a microscope recently. Selonsertib in patients with diabetic kidney disease, phase 2b randomized active run clinical trial is the paper I would like to talk about today. In a randomized placebo-controlled phase 2b study, researchers compared the effects of selonsertib with placebo on eGFR decline in people with type 2 diabetes mellitus and chronic kidney disease. Diabetic kidney disease affects roughly 300 million people worldwide, and the incidence continues to be increasing in parallel with the global prevalence of obesity and type 2 diabetes. Patients with diabetic kidney disease experience exceptionally high rates of cardiovascular complications, including accelerated atherosclerotic vascular disease, heart failure, and premature death. Management strategies for kidney and cardiovascular risk reduction include lifestyle modification and blood pressure control, preferably with an ACE inhibitor versus angiotensin receptor blocker. More recently, sodium glucose transporter or SGLT2 inhibitors and mineralocorticoid receptor antagonist finerenone have been recommended because these therapies have shown clear benefit when administered as adjunct to ACE inhibitors or ARBs. Nevertheless, most patients with diabetic kidney disease experience progressive loss of kidney function. The pathophysiology of diabetic kidney disease is characterized by activation of multiple pro-inflammatory pathways. Apoptosis signal regulating kinase 1 or ASK1 activates a signaling pathway through which oxidative stress promotes inflammation, fibrosis, and apoptosis. ASK1 may be a therapeutic target for diabetic kidney disease. Selonsertib is a first-in-class small molecule inhibitor of ASK1. In experimental models in the past, rat studies took place in a model of diabetic kidney disease where selonsertib reduced glomerulosclerosis and slowed decline in GFR. However, selonsertib caused an unanticipated acute eGFR decline potentially related to the inhibition of creatinine secretion that may have masked a beneficial effect after accounting for the acute reduction in GFR. Post-hoc analysis suggested that selonsertib may slow GFR decline. These findings supported the design and conduct of the MOSAIC trial. MOSAIC trial stands for Study to Evaluate Efficacy and Safety of Selonsertib in participants with moderate to advanced diabetic kidney disease. MOSAIC was originally designed as a large phase 3 event-driven trial. Owing to complexities of understanding possible selonsertib-induced interference with creatinine secretion, the trial was redesigned as a confirmatory phase 2b trial comparing Selonsertib 18 mg with placebo using a longer-term eGFR slope as the primary efficacy outcome. Mosaic was a randomized, double-blind, placebo-controlled phase 2b trial evaluating the efficacy and safety of selonsertib 18 mg daily in patients with moderate to advanced diabetic kidney disease. Trial participants were adults aged 18 to 80 years with type 2 diabetes, defined by a prior diagnosis of type 2 diabetes and hemoglobin A1c over 6% within 30 days of enrollment and/or receiving treatment, and chronic kidney disease with GFR of equal to or above 20 and below 60 milliliter per minute per 1.73 square meters. After the screening period, participants were enrolled into a run-in period of 5 weeks, which was included in the study designed to account for an acute decrease in GFR associated with selonsertib initiation. The study ran from July 2019 until September 2021. Initially, 961 patients were screened, but of these patients, 384 eventually entered the study. The numbers further declined about total entry of those cases due to withdrawal of consent. During follow-up, 37 patients in the selonsertib and 38 patients in the placebo group discontinued study medication prematurely. The outcomes of study show that adjusted mean estimated GFR creatinine slope from treatment-specific baseline to week 84 was minus 2.29 in the selonsertib group, while it was found to be minus 3.49 in the placebo group. Kidney clinical events were reported for 26 patients, which is about 17% in the selonsertib group, and 19 patients, which is about 12% in the placebo group. In summary, the Mosaic trial assessed the effects of selonsertib compared with the placebo on the rate of kidney function loss in people with diabetic kidney disease. The trial met its primary objective for participants treated with selonsertib compared with placebo. In total, 310 patients were randomized, of which 154 received selonsertib and 156 received placebo. Mean difference between selonsertib and placebo estimated GFR creatinine slopes at week 84 was 1.20 milliliter per minute. Kidney clinical events occurred in 17% of patients randomized to selonsertib and 12% of those randomized to placebo. The most common investigator-reported adverse event was acute kidney injury. The authors claim that the higher rates of investigator-reported acute kidney injury might be a reflection of the real effect of the agent. The main limitation of the study was relatively low number of participants. In summary, selonsertib attenuated the decline in estimated GFR creatinine over up to 84 weeks. However, it resulted in a numerically higher number of patients reaching a kidney clinical event and a numerically higher rate of investigator-reported acute kidney injury. In conclusion, the MOSAIC trial supports a potential effect of selonsertib on estimated GFR slope that remains to be precisely defined in a future trial. Thank you for listening.